Health Spotlight, presented by Community Health Network.
To our health spotlight now. The CDC drops Indiana to the minimal flu risk for the first time this season. The map update comes the same day Indiana's health department reports 7 new flu deaths. It brings the total deaths this flu season to 163. That's the highest total since the 2017-2018 season of 336.
Let's welcome in Wish TV medical expert, former U.S. Surgeon General Dr. Jerome Adams. Sir, you just heard the flu numbers today. Is the worst of it over?
Well, I'm hopeful that the worst of it's over, but it's important for people to remember that we will often see a second or sometimes third spike in flu activity when you get to February or March. So what I would say to folks is, thank goodness we're on the downswing. Hospitals aren't overwhelmed. But if you haven't gotten your flu shot, it's not too late, and we may not be out of the woods yet.
Out to a COVID-19 headline today, an FDA panel is unanimously backing a plan for an annual booster made up of the same ingredients as the 2-strain shots. In your view, have we reached the point that we can simplify the use of COVID vaccine?
Great question, and I want folks to know where this is coming from. We have less than 15% of the population that's gotten a bivalent booster, even though a new CDC study came out last week showing that booster to be 50% effective at preventing infection and even more effective at preventing hospitalization and death. One of the problems that we hear from people is that the advice is too complicated. Which shot should I get? How often should I get it? And so, yes, it is the time to try to simplify the advice to people. The decision that they made this week today was to actually get rid of the vaccine, the original strain of the vaccine that they have, and to give everyone a bivalent booster moving forward. So that would make it simpler for patients and for physicians. And they're still debating over whether or not to go to just one shot a year the way we do with the flu shot.
So what does it look like moving forward, and the questions that people will be asking themselves? Who really needs another shot? How often? What kind? Et cetera?
Well, I would say people over 65 absolutely should get that booster shot because they're still the people who are at highest risk of dying. But the people who actually benefit most in terms of prevention of symptomatic disease in the latest CDC study are younger people. So I've gotten my booster. All 3 of my kids, 18, 17, and 13, have gotten their booster because I don't want them to miss school or to miss another activity. So really, everyone should get their booster, just as we do for the flu. And moving forward, we may see that it's just once a year, just like the flu shot.
And we've grown accustomed to hearing right around October is really you start getting that push for get your flu shot, flu season, cold and flu season. Is there going to be such a thing as a COVID season?
Drew, that is the big debate. We know that flu usually comes around the same time every year. Unfortunately, COVID has not shown that same seasonality. We've had COVID spikes in May. We've had COVID spikes in August. And so that's what makes this decision in this debate so tough. But what we do know is in the wintertime, people come indoors, they're closer together, and they're more likely to spread disease. And we know that when we make things simple for people, they're going to be more likely to get that booster. So I do expect that we will eventually get to a point where we're getting one COVID shot a year for most of us, and it will be around the same time we get the flu shot.
We are expecting in just a matter of days to hear the vote results from the World Health Organization on declaring the pandemic over. It seems like Indiana and the U.S. is already there.
Well, there is the practical and functional question as to whether or not the pandemic is over. And then there's the scientific and policy question. A public health emergency of international concern, which is what the WHO is debating, can be declared when there is a sudden, unexpected increase in viral activity that has the potential to cross borders and may require a coordinated international response. Why did I go into that detail? Because if they end this emergency, then they won't have many of the tools available to make vaccines and additional funding available for people across the planet. So even though we may feel like the pandemic is over, we've had an increase in cases in China recently. We're seeing more cases over the last several weeks than what we had before. And I don't think it's time, and I don't think the WHO is going to say that it's time just yet for us to end that public health emergency.
More layers to strategy and bureaucracy than a lot of people probably realize when it comes. They think in their behaviors that the pandemic is over, but you make good points there for our understanding of it. Dr. Jerome Adams, thank you so much for your time.
Thank you. I appreciate it.